Okay, this is the pain management um, capture number 1. So, myths of pain and treatment. We all know these. We've heard them our whole life. One of them is no pain, no gain. This is a very common one you hear in the gym. If you're not going to feel pain, you're not going to build up your muscles. Studies show that pain is a reason to slow down, to take it easy, to let the muscles heal. So no pain, no gain. Sometimes for the person who doesn't know what they're doing or doesn't know when to stop can cause damage. It's all in my head. Pain is a very complex mechanism that our body has. It entails different types of pain, the central nervous system, psychological. There's a lot of things going on. So someone may have pain. It says they say what it is, and they can't find a reason for the pain. Doesn't mean they're not having pain, and it also doesn't mean it's psychological. It becomes a very complex issue, and that's why over the last 10, 15 years, pain management doctors have become specialized in the treatment of pain with all the different kinds of ways to treat, and that's their specialty. Most doctors don't have that specialized training. I just have to live with pain. It's just part of life. Well, unless there's absolutely some reason you're having pain because of a traumatic accident or something like that, pain is not a normal thing. We're not born being in pain the rest of our lives. Only sissies go to the doctor for pain. This is very common, especially in some cultures where, if you go to a doctor, you're not being man enough. You need to just buck up. And a lot of comments out there, and it's very common among the elderly especially, that if you take pain meds, you're going to become addicted to the pain medication. And, under the proper usage, that's just pretty rare that happens. So barriers to pain management. It could be the age, what age is the patient? Men in the U.S. from about 40 to 60 years old can become pretty obnoxious about pain management. They think it's going to go away. I'll walk it off. It'll be better tomorrow. I'm not going to the doctor. That could be an area. Gender, males versus females. It could be a money issue. It's very expensive to walk into an ER or walk into a clinic, and some people think it'll go away. And some people just hate doctors. They don't want to go to a doctor. They don't want to go to a hospital. It's ingrained probably from hearing their parents or others speak that. Doctors don't do any good for you. So, physiologically and psychologically, consequences. Patients with chronic pain, they usually have some form of depression. It could be slight or it could be chronic depression. This weighs people down. They have a hard time doing ADLs. They have a hard time holding a job. They become very, very debilitated. Some surgical pain or a normal procedure for unknown reasons can lead to chronic pain. And this is where doctors sometimes are, I don't see a cause for any pain. We've checked you out. We've done these tests. So sometimes it leads to chronic pain. Malingering. Malingering is where patients just psychologically prolong everything. They want the attention. So that could be a psychological issue. So cultural barriers for pain control. Well, there really are people out there that believe that if God wanted me to be pain-free, he would take it away, and it could have a religious connotation. I was meant to have this pain. This is part of my trial that I have to endure in life. I will be a better person having this pain. I will have a better reward after I die because I was able to bear this cross of pain. Culture barriers, men don't cry. Gender and also cultural. Buck up, pull up your bootstraps. Little pain didn't hurt anyone. Um, Now you get other cultures from different countries, and they also have different ways of managing pain or not managing pain. Um, and we'll talk about some of those next week as well. So pain, it is the number one reason patients go to a hospital or they seek health care. Pain is the number one. Doctors, nurses have an ethical duty to relieve pain to the best of our ability. It's part of the doing good, helping the patient. Pain can be increased by stress. People that have chronic pain, stress will make it worse. People that hold their stress in their neck and their shoulders, they will have increased amount of pain, tightness. So it goes back and forth. Stress can cause pain, and the pain is also going to increase stress for the patient. Untreated pain can lead to chronic pain, as I mentioned before, but it also becomes hypersensitive. Something that just started out in your gut as just some normal pain over a long period of time, it's not just localized, but now it's the whole gut that hurts, or it's a larger area. So your skin and movement becomes hypersensitive, and the pain just seems more intense. So types of pain. Well, visceral pain. Visceral pain is basically um, localized to the injury. It can actually be localized on a dermatome. Um, it can be referred by that dermatome and the nerve running through it. Um, a clue to this kind of pain is I ache all the time. Visceral pain can also be, for example, internal organs, visceral pain. Muscle pain obviously is easier, everybody's had that. It's sometimes easy or difficult to isolate, but we know what it is. I feel stiff. It feels like a Charlie horse. It feels like a muscle is pinching. So this could sometimes be caused by an underlying disorder or a metabolic cause. Bone pain. Bone pain, it can be an ache, it can be intense pain. It's usually localized. We know it's going to hurt more on movement or weight bearing. Could be worse at night. It could be masked by muscle pain. Some people that have bone pain think it's muscle pain, and muscle pain could feel like bone pain. Spasming around the muscles could also be a form of the bone pain. Things you'll hear about this: it hurts when I move, it aches all the time. Neuropathic pain. Neuropathic pain is basically that superficial burning pain. It's the root of the actual damage to the nerve root where the nerve passes. So it could come from the spinal cord, it could come from a dermatome. So it's going to increase or decrease based on nerve compression, things like that. So comments you would hear from a patient: it feels like my skin is burning, it feels like my feet are on fire, it feels like someone stabbed me, it's a shooting pain, sciatica, it shoots down my leg. Those are forms of neuropathic pain. Pleuritic pain, basically pain that's going to increase or be noticeable when you breathe in, shallow breathing. It's the worst pain I ever have when I breathe in. That's what you might hear. Colic pain is basically pain that comes and goes like cramps, could be caused by gas. It feels cramping, it comes and goes. Those are the kind of comments you would have. So acute pain. Acute pain, we all know, could be after a surgery, after a trauma. Acute pain comes on because of an injury, surgery, something's taken place. It's instant, but usually it's going to go away. However long the healing takes, acute pain will pass. Chronic pain is the pain that's lasted for more than 2 to 3 months. And we know the cause of it, or there again, we may not know the cause of that chronic pain, or we do know what's causing it, but we can't fix it, so it becomes chronic pain. A compression in a disc in your back, we know what's causing it, but the patient, because of other reasons, can't have surgery yet, or they cannot have surgery because of comorbidities, so it becomes chronic pain. Chronic pain can come and go, but it's usually always there. It can exacerbate.